talking so much about the aspects of how people are practicing therapy that I don't believe in, that I thought it might be good to shift a bit to thinking about some of the things that I think actually do create change and are really essential parts of how we practice. And I wanted to start by talking about trauma-informed care, because I really subscribe to the idea that there is trauma-informed care and that it has to be practiced with a lot of intentionality. I want to first start by substantiating what I mean by trauma-informed care. So for me, trauma-informed care, which in a lot of spaces has kind of lost its meaning, is one, trauma-assumed care. I assume the presence of trauma. I don't even need to wait for my client to tell me it's there. I'm going to function in a way where I assume that it's been part of this person's life. Secondly, I believe that trauma has an intergenerational pattern that is passed down genetically and lives deeply within the body and tells the body how to respond to things. And in addition to that, it's also ongoing, and there's stimuli at all times creating traumatic responses. So we have it coming from the past and the present, and there's an anticipatory piece around how we're preparing for it in the future as well. I don't feel like we're working with past trauma. I don't think that that's like a real thing. I also believe that trauma-informed care has to be completely consent-driven, meaning that literally every intervention I use, every question I ask, everything I say, I ask for consent around. Would it feel okay if? How would it feel to you if I shared my feelings about? I'm going to offer this idea. Can you let me know if this feels okay to you? And that's in the interest of radical transparency around this process. And it's in the interest of trying to rebalance power in such a way that the trauma is not reenacted in the therapeutic relationship. Another aspect of trauma-informed care that I work with is that I'm systems suspicious. I don't trust systems. I think people have been really hurt by them. And I'm mostly just curious about how my client has been hurt by systems around them, mostly medical or mental health related systems. And lastly, my way of creating trauma-informed care is that I never presume a specific neurotype that is sitting in front of me. I never assume a level of physical health that is sitting in front of me, nor do I assume that there's cis heteronormativity sitting with me. I imagine that everybody I'm sitting with is dealing with an intersection of marginalized identities that has impacted them and the way that they experience the world. And I'm making space for all of that as I create every single intervention I use with my clients.